Many villages, especially Uganda, mental illness goes untreated, misunderstood, and hidden. But there are communities that are learning that mental health is real, recovery is possible, and there is help which is available. So in today's video, we are going to show you how we are bringing closer hope to people who have been forgotten in our communities. And this hope is we are bringing it to the people in the Tororo District. Before we go into our video today, or showing you some of the activities that we are doing, Tororo District is found in eastern Uganda, and it is a border district which is bordered by Kenya to the east, and in the north we have Malaba District. We also have Manafa District which is surrounding it, and also we have Busia District which is a surround it in the west. Then we have also Bugiri which is in the southwest. So today we begin some of our activities here. Tororo is well known for having industries like the Tororo cement industry, but also one of the brand names which it has is the rock. If you have not visited one of the rocks here, it is the one which gives Tororo its name. It is one of the brands that are used here, and our mission here is to create awareness in the whole of the district, and my mission is to see that people can get the mental health messages, because people have different beliefs about mental illness. So the mission, we started by carrying out the sensitization in the villages, and we started with the municipalities, because we have so many clients also within the municipalities. So we began with the villages in Chamwinula, and so in all these villages, our activities, we are teaching people about what is the meaning of mental health, the causes of mental illness, the misconceptions and myths about mental illness, the prevention means, how can they prevent mental illness, and the complications of not treating mental illness. So most of our activities, we have been doing them in every village, every Friday. So we are working with different teams, and I would love to appreciate the team from Heart for Families International, who have been supporting me to mobilize the members in the society, talking to different leaders and giving us permission to be able to speak to people about mental health. Heart for Families International, it is an organization which is found in Tororo, and they help total orphans, people who have children who have lost all their parents, and they are below the age of 10 years. They support them with all the requirements, they educate them. So they have been helping me to achieve this, and we are still moving around the municipality. Our mission is to reach the whole district with their messages, and one of my aims is to see that we have a community that is well informed, that has improved health-seeking behavior, especially the mental health part of it. So we began on the 3rd of October, where we started from Chamwinula. It is a village which is found in Tororo District, and we reached over 20 adults, and we are able to meet some of the community leaders, the pastors, the LC ones, the head of the school, and we met at the Chamwinula Primary School, where we are able to teach the community about the causes of mental illness, about epilepsy, about depression, and we had such a nice activity there, interacting with the community members, some of the VHTs The VHTs, we could call them the doctors of the village. Those are the people who knows where people who have been affected by mental illness can be found, even other sicknesses. And those are some of the people that our Ministry of Health in Uganda uses to identify some of the people who are suffering. For example, if there is an epidemic, they can be able to locate where this thing is coming from. So we are able to meet some of them, and also we met some of the religious leaders where we shared messages about mental illness during this activity. In Uganda, the research shows that 70% of people with mental illness reach the pastors or the religious leaders before they can go for support in the village. So we thought it wise to meet such kind of people because they are influential in our communities, and we have been moving in different places. We are not only going at the village level, but also we are looking at different target population. For example, we are looking at the health workers. The health workers, especially the primary health workers, because we know these are the first people who get in contact with these patients. And some of them, they don't know how to handle people with mental health issues. So I was able to, in my first community activity, I was able to visit different health facilities, and I was able to reach Malaba Health Center free. This one is bordering. It is near Kenya, where there's a lot of businesses, and I was able to meet over 10 health workers, and I was able to educate them about mental illness, the causes, the prevention, how they can identify that someone is having a mental illness. And I was able to go to different departments, the OPD. There is also what we call art clinic. Nowadays they are calling it chronic care. I was able to share with different health workers who are working in that department, those people with HIV, people with TB, they are managing this clinic, and even people with mental illness. The government has combined these clinics together so that they can be handled together, but there is a gap there because most of the people who are working in that clinic, they have been only used to managing people with who have HIV, stroke, AIDS. So I was able to have a good interaction with them about this, and I also moved to maternity ward, where I was able to share with the health workers, the midwives. Sometimes our mothers get mental illness like postnatal psychosis, where they don't want to breastfeed the child. Sometimes they feel like killing their babies. Sometimes they can also receive mothers who have sicknesses like epilepsy, and they require someone who can help them, so that they can be able to deliver this mother. So I was able to have a nice interaction with them, and also from there I also moved to Mudakori Health Center. There I met about three health workers, because most of the people had gone for lunch. They had done some of their work, but I was able to interact with the in-charge and some of the midwives and share with them about our message. Then also I was also able to go to Paragon Medical Center, that is found in Malaba, and it is a private facility where I also able to interact with two medical workers that are working in that place. I shared with them about mental health and how they can refer the clients for us to manage at our clinic, at Dr. Bale Medical Clinic, and we had a nice conversation. So our mission here is to ensure that people have access to these services, and one of my targets is that our mission, and is to have a mental health hospital which has good general services, and also which can handle different types of mental illness. But Tororo being a border district, it is having it is a catchment area where patients are coming from various places and coming to receive the services. But when you go in some of our facilities, we don't have mental health specialists. You find most of them have psychiatric nurses who are overwhelmed, and most of these patients are referred to Malaba District, which is a 1-hour drive when you are using a public means. So Mbale has a regional referral hospital, and they have a psychiatric unit. So you find that these people have to spend some good money and have to be taken to Mbale to be able to receive the service. If Mbale is not able to support them, they are supposed to be referred to the National Referral Hospital, that is the Butabika Hospital, which is also full with mental patients. So our approach is to attend to these patients, and the best way of managing the client is home-based care. When you manage the clients in their communities, they receive the psychosocial support, the family support, and these places they are able to recover faster than being managed in a hospital setting. So our activities in Chamwinula was a success because we are able to reach all those number of people, and we are still continuing moving with the mission. And I would love to appreciate ACT International. It is an organization that supports children who are affected by trauma. Children, for example, sexual abuse children in Dao, when they witness their parents being killed, maybe being raped, so they develop what we call PTSD. So it supports such kind of it. So I want to appreciate them for supporting this mission with transport, and also want to thank I want also to thank the Heart for Families International for mobilizing community members to here. So our mission is still going on, and we want to reach the whole district with mental health messages. But Tororo District is so big, and I am one man plus my colleagues from Heart for Families International, then my colleague Dr. Bale, whom I'm collaborating with or partnering with to offer private mental health services in Tororo. So if you are new to this channel, I request you to subscribe, and I also request you to watch the videos, to like, to comment, and also if you have any questions, please, you can be able to put them there or to ask them in that comment section. In Chamwinula, we have so far received patients who are coming from there, and who, because of the activities that we have done there, sensitizing them about the illness. So we are receiving patients who are coming from there to receive the mental health services. These are especially children. So far we have not yet seen adults, but the team from the villages, they are still sending those people to come to us for support. So thank you so much for watching. If you are not subscribed, please subscribe and comment. That motivates me to make more of these videos. So our next activity is going to be in Bison B, that is also found in Tororo Municipality, Tororo District, and that is in Uganda. So thank you so much. See you in my next video.